Good afternoon, everybody. Coach Armando Torres here, and it is Monday's call for ACA and Medicare training. We are moving to a new time, which is 1 p.m. Eastern Standard Time. We'll be on Mondays, so 1 p.m. Eastern, 12 for you guys in the Central, 11 for Mountain Time, and 10 a.m. for you guys in the Pacific. We moved for that purpose so we could start building into the Pacific. We got California under Get California. We'll talk about that in a second. Already on top, ready to rock and roll. So we are now a full 48 state operation. We're still waiting on the licensing for New York and Massachusetts, which we should have any minute now, and then we'll be a full 50 state operation. Today we're going to be discussing ACA, Affordable Care Act, Obamacare, and I'm going to share with you guys that this is a 12-month opportunity. Okay, this is a 12-month opportunity. A lot of people think that you can only do healthcare during open enrollment. Guys, we do about 2 to 5 times more business outside of open enrollment than during open enrollment, right? I'm not saying that open enrollment is bad. Definitely you want to run with open enrollment, pick up a bunch of bonuses, stuff like that. But right now, it's a great time to build your book of business. So without further ado, guys, I'm going to share my screen, and I'm going to go right into the presentation today. I know we have some of the leaders ready to accept any newbies that are coming in, but we'll go ahead and start this presentation. So the name of the company is Powerhouse Health Partners. This is our health division. We work with different IMOs and different agencies. You may be with a company or an agency that we are their strategic channel for distribution of health products, which is Affordable Care Act, ACA, as well as Medicare, right? So we are your strategic health insurance FMO. My job, our job, the job of this opportunity is to get you off of the income roller coaster. So I need you to write that down. Get off the income roller coaster. Guys, I've been in sales my entire life, and we've had phenomenal months and we've had phenomenally bad months, right? I don't know if you can relate, right? Especially in the real estate business that we've been in life insurance business, we have good months, especially in our life insurance. We have good months, and then we have this chargeback monkey that jumps on our back, and then we're in trouble for a little while, and we got to get out of that. This is going to help you stabilize your income, okay? I need you to stabilize your income. I want to start by giving you a history lesson. The Affordable Care Act was started in a think tank, in a conservative think tank in Massachusetts, originally known as Romney Care, right? And then the U.S. federal government was able to pull it off under President Obama, and that's why it's affectionately called Obamacare. But the true law is the Affordable Care Act, okay? Affordable Care Act. You want to write that down? We call it ACA. It was challenged 3 times in the United States Supreme Court. 3 times it went to the United States Supreme Court. The 3rd time, it really looked bad for them, right? But I'm not sure exactly what happened. Trump pulled it, and again, I'm not going to get political whether one side or the other side, guys. I'm going to just share with you facts. There was the pulling of the fine. It used to be that you were fined, or you had to pay a fine if you didn't have Affordable Care Act when it was first written. That was pulled out of the law. And when it went to the U.S. Supreme Court in 2018, there was a huge ruling, not last year, the year before, right, in 2021. And the ruling states a 7-2, listen to this, conservative court. A 7-2 conservative court upheld the law. Guys, and again, I'm not going to get political. I'm just going to shoot straight facts. If a conservative court upheld this law, there's no liberal court in the history of this country. I mean, there is no liberal court in the history of this company that will ever defeat the great legacy of Obama, right, in Obamacare, right? So my professional opinion is that this law is here to stay for a long time. We have a lot of years to really put our teeth into this and just build it. And then in addition to that, the CARES Act and the Infrastructure Act have added to it to expand it to even lower the payments. So a lot of our customers this past year, the renewals actually have a lower payment, the majority of them, 90%, right? I still have one customer, which is my sister. She was at 78 cents a month and went up to $1.41. She was the only one who called me and asked me why her insurance went up. But outside of that, guys, this is the time to build, right? We've had a lot of pioneers. We got a lot of friends that have made a lot of money over the years with Obamacare, right? And they're making this residual money. Now is the time to really go after it and build it hard. So, health insurance option, again, ACA, also known as Obamacare. Guys, let me debunk a few myths. Everybody qualifies. Now, they qualify for the insurance. They may not qualify for the full credit, right? But everybody does qualify. So if you got somebody that's making $400,000 a year, they qualify, even if they have diabetes, if they have previous, if they've had a heart attack, if they have cancer or AIDS, God forbid, right? There's no pre-existing condition exclusion. Everybody qualifies year round, okay? You're 0 to 64 years old, right? And 64 and above if they do not qualify for Medicare. We have some people in this country, right? They either came too late, possibly. You have, like in Texas and Florida, you'll find people that immigrated to this country too late. They didn't pay enough into the Medicare, and they don't qualify for Medicare. They will qualify for Obamacare. Now, if they're between 100 and 400% of FPL, and we're going to discuss that in detail tonight, they will get credits to lower their cost, right? They will get credits from the government. 87% of all families on Affordable Care Act in the United States of America pay less than $10 a month for the whole family. Let me slow that down and repeat that so you understand how powerful this is. 87% of all families in the United States of America pay less than 10%. 90% of my book of business pays zero. And yes, I do have a book of business. I lead from the front, and so do all of my leaders, right? We do not have people here just sitting around collecting corporate paychecks, right? Everybody here is running and doing it from the front, right? Guys, this is crazy because we get paid per member per month. Per member per month. And for those of you guys who have ever done any network marketing, Amway, Herbalife, juice, potions, lotions, you're going to see when I tell you that is a phenomenal business opportunity that, number one, most people don't know about it yet. A lot of people think that Obamacare went away with Obama, which is false. And number two, so I want to make sure that you understand that. And number one, there's still a product that people will be like, really? when you tell them about it, right? And number two, when you can have an auto ship or a monthly payment of less than $10 a month, and you're making hundreds of dollars a month in residuals, that's a great business opportunity. I'm going to share with you exactly how that works. We get paid per member per month. Per member per month. You want to write that down, PMPM. I want to get it tattooed on me. I mean, that is the most amazing thing in the world that I've ever heard of, per member per month. And we'll go into some serious detail here on that, right? So Affordable Care Act, it's a year-round opportunity. Right now, there's an SEP, special enrollment period. If you're between 100 and 150% of federal poverty line, you qualify. If you recently moved, you qualify. If there was a lot of other situations, there was a change in the family dynamic, a change in income, you lost your job, you gained a job, you most of the times, there's a special enrollment period where you qualify, okay? So we're going to focus today's training on this 100 to 150 federal poverty line, okay? In addition to that, annual enrollment period, which happens in November. Guys, those of you guys who are builders, I know there's people on the line today that they're like, I came here to obviously build my book of business, lead from the front and get my money, right? But in addition, I want to share this with other people, and I want to get, a huge team going, and I want to create some incredible residuals. I'm going to talk to you as well. You want to go hard between now and October in recruiting an army. So November 1st, when it's go time, it's a lot better if you have 10 people more. It's better if you have 10 than 1, right? And it's better if you have 100 than 10. And it's better if you have 1,000 than 100, right? Like, the bigger your army out there to help Americans, families get properly protected, the bigger the explosion you're going to have, because we do have residual overrides on top of what the agent makes on street without taking a dollar away from our agents, which is phenomenal. And that happens between November 1st and January 15th. So this is just a chart. We're going to go into this a little bit. You get paid per member per month anywhere between $18, actually $15 in United if you are in Alabama, right? from $15 all the way up to $30, right? If you're in the right state, or if you're licensed, non-resident, to do business in the correct states. And I'm going to tell you right now, Florida and Texas are the best states to build this business. However, we do have business in all of the states, right? We can do this business in all of the states. But if you're living in Alabama right now, I highly encourage you to get a non-resident health license in Texas or Florida, because there is where the biggest dollars are going to come for your efforts. Okay. ACA is carrier specific, and again, that says 18. It's actually down to 15 with United, but it's $15 to $30. Average is $25 per member per month. Guys, I want you to write that number down. PMPM, per member per month. Okay, that's the most important acronym in the entire insurance business and health insurance, right? An example is a 4-person household, mom, dad, and 2 kids. An average of $25 PMPM. You walk into a house tonight and you quote it and close it. 25 times 4, that will give you $100 a month pay raise. $100 a month. And again, early on, I told you guys I want to get you guys financially free. I hate it when my friends talk to me about their onion check. You guys ever heard of the onion check? The onion check is when you open it on Friday and it makes you want to cry, right? And some of you guys have experienced that. I've experienced it a lot in my life, right? When you get this check and you're like expecting to do great things, but it's already spent, right? It's already gone. Let's get you off of that onion check. And here's how we run the numbers to become financially free. I want everybody who's on this call, whether you're live or in the recording, take out a piece of paper. And I want you to write FIN equals. That means your financial independence number. And I want to pause a second. I want you to think about this. I'm not saying to go hunt lions in Africa. We'll get to that part, right? To go drink wine in France and to go, Tahiti and Hawaii. We're going to do all of that fun stuff. But right now, I need you to calculate in your head, and today, throughout the course of the day, calculate an exact number, right? Maybe pull your bank statements and pull your credit card statements and stuff like that. What number do you have to come up with every single month to become financially free? In other words, how many dollars go out? And so how many dollars need to come in so that you are exactly financially free, right? The moment you are equal, that those numbers are equal, you become financially free. So take a second here and write those numbers, write that number down. Take a second here and write that number down. What is your financial independence number? I know a lot of you guys are in financial service on the life side and you probably calculated already, but what I found, unfortunately, in Spanish, we have a saying, casa de herrero, cuchillo de palo. In a blacksmith's house, usually you're running with a wooden knife, right? So take a second and calculate that number. So if the average PMPM, now let's do some math. You might need to take out your calculator, but make sure you have that number written. If the average house PMPM is going to be $25, divide your financial independence number by 25. That'll get you the exact number of members that you need. As an example, let's say you need $5,000 a month. And you divide 5,000 by 25, that's 200 members. You need 200 members, right? And how do you get to 200 members? Well, you go to families, right? You market to everybody that you know, but you concentrate on getting people that have families, right? You go to your personal family, that people have kids. You go to your school, PTSA or whatever. You go to the community library and you advertise there, and you everywhere that families congregate, right? Churches. So you divide that number. So your FIN divided by 25, let's say, gives you 200, and then it divide that by 4 because that's the average number of family members, right? PMPM. So how many families do you need? How many families do you need to become financially independent? Let me make sure you understand that. You're going to come up with your financial independence number. Let's call it 5,000 as an example. You divide it by 25, right? In this case, will give you 200 members. And 200 members, if it was 4 members per household, you need 50 families, 50 households to become financially independent. Now, those of you guys who are doing anything else, right? Real estate, or life insurance, retirement planning, wealth management, right? We have everybody on our team. You know, we have strategic partnerships with a lot of different companies, right? How easy is it when you walk into a house to sell whatever it is that you sell, and you know that your bills are covered? Wouldn't it be amazing? That you're not walking in with commission breath. You're not worried whether you make that sale or not. You're not worried if you have to come back for a second appointment. Wouldn't that be amazing? Can't you build something huge if you didn't have that financial stress? Imagine that, right? And I'm going to share with you guys, we have guys on our team that they're now at $27,000 a month. And I have a lot of guys and girls on our team that with a poo-poo effort, they're at $300,000, $500,000 a month, right? It depends on your effort, right? Results vary, right? But if you get after it, and now knowing that it's a 12-month opportunity, come on, it's a wrap, right? You just got to know what your north is. You got to know what your financial independence number. There's a saying that I've said before: if you don't know where you're going, how do you know when you get there, right? So a lot of us get into businesses. We don't really know much about money or about business, and we just try to go to work every day and really get kind of frustrated. Mr. John, if you can mute yourself, please.
Lord, we just thank you.
Or one of our co-hosts there can mute us out there.
What's going on? God be.
All right, thank you. All right. So my goal here is to help you fire your boss, right? Step number 1 is to fire your boss. Use this as a vehicle to fund your life, right? Then once you fire your boss, you can go build it big, and then you can go ahead and live and fund your dreams, right? Whether that be a vacation house, whether it be a dream car, whether it be dream vacations, whatever it is, right? You can do it, but you got to make sure that you get that money coming in every single month. And the easiest and fastest way to do that is through health insurance, okay? So I'm going to show you guys the 2 tools that we use for ACA, right? But before we do that, I want you to take a screenshot, because here is the step, right? If you're interested in doing business with us, right? Here are the steps. Number 1, if you're not health licensed, you need to get health licensed. So you got to go to examfx.com and you're going to apply for your health license. If you only have life, you need to apply for health. If you don't have neither health nor life, I encourage you, regardless in which IMO you're with or which agency you're with, I encourage everybody to get their life and health license. Your opportunity is way bigger with that, right? Now, if you already have your health license, you're going to send an email. So go ahead and take a picture of this. You're going to send an email to contracting@powerhousefin.com and request health contracts. And they're going to start sending you health contracts and what are your next steps for your FFM and AHIP and all the other stuff, right? So go ahead and send an email to contracting, and they will help you get contracted, okay? So that is our presentation, number 1. And I also want to give everybody my personal cell phone, and then you're going to see that Patty, and which is another one of the trainers on the team, and Tony and some of the other trainers, that will give you our cell phone in case you get stuck, right? Sometimes you're going to be with a client and you don't remember what ACA means. All right, it's happened. Go ahead and feel free to send me a text message. I'm available Monday through Saturday, and you can reach me via text at 305-409-6835. Again, 305-409-6835. Don't call me to get recruited. I am not recruiting anybody, so you gotta go to your upline. I'm just here to support you when you're in the field, when you get stuck with contracting, when you get stuck with whatever. That's what I'm here to do. Armando Torres is my name. I'd be happy to help you get through the process. Okay, so that's the presentation part of the show. Let's go into some training here. This is my favorite part of the show. When we get into some training, let me stop the share here and open up a new window. I'm actually going to pause it a second and answer any questions that there may be at this time. Screen. All right, so let's get into some cool training here today. So let me get this. How do I get out of this? So they just did this new. I want to share my screen, but I don't. All right. Exit full screen. All right. So the first thing you're going to look at is your federal poverty level. Okay. Federal poverty level is the most important part of this. Let me see if you guys can see that. Can you guys see that here? Numbers may look a little small, but you can pull it off. I'm going to go ahead and put it on the chat. For those of you guys who are live, you guys can pull it up on your end. You might need to put that in your browser. All right. So federal poverty level. Here's how this works. Anybody who's making less than 100% of the federal poverty line will typically qualify for Medicaid. Medicaid, not to be confused with Medicare. That's another thing. Medicare is usually for retired folks or for disabled folks, people over 65. Medicaid is for low-income families, right? So anybody's less than 100% usually will qualify for Medicaid. During last year, during the Corona period, the Medicaid was expanded. Listen to this, guys. This is super important and super powerful for the opportunity. Medicare was expanded due to the coronavirus, and it's called coronavirus Medicaid, right? That's done. So last month in the state of Texas, 975,000 people were advised that they were going to be taken away from Medicaid. In Florida, 1.7 million or 1.9 million were given notice that they were going to be dropped from Medicaid. They have to now go find a broker like you to apply for Obamacare or ACA, whatever you want to call it, right? So that's a huge opportunity, folks. If you know anybody who's any doctor's offices, if you know any doctor's offices, I would contact them and I'll be like, hey, I need to help you because there's the coronavirus expansion program for Medicaid is coming to an end. It's called sunsetting, right? Let me help you call these people and get them on an Obamacare program that you accept, Mr. Doctor or Mrs. Doctor. Okay, huge opportunity. Anything less than 100%, you're going to see now is going to have Medicaid, but from 100 to 150%. So 100 to 150%, that's the special enrollment period that we have this entire year. Okay, Mr. John, if you can mute yourself again. Somebody can mute John there.
Sí, yo creo que John en este momento está trabajando con alguien para otra persona en
Mr. Jones. All right. So let's give an example. A family of four, if a family of four, they have to make a minimum of $27,750 to qualify for ACA. Okay, they have to make a minimum of $27,750. For the purposes of special enrollment, maximum of $41,625, right? So if they make $41,626, they don't qualify today for that special enrollment period. Now they may qualify for another one, but they don't qualify for that one. Okay. Now, am I still recording here? Can you guys see that I'm still recording?
I don't think so. I don't see it.
Oh yeah, it looks like it. And that's why you want to be live, because there's little tidbits that we give live that we can't put on the record. But anyways, back to business here. By the way, our calls are on Mondays at 1 p.m. Eastern Standard Time at www.powerhouseempire.com. Powerhouseempire.com, Mondays at 1 o'clock Eastern Time. All right, so back to this. So you're going to write the business right now with the special enrollment period between 100 and 150% of the FPL, federal poverty line. Okay, So a lot of families, 4 people, are, you know, making $35,000, $39,000, $40,000 a year. They qualify right now for open enrollment through the SEP, special enrollment period. Now, throughout the rest of the year, you're going to look at these numbers, right? Just to see more or less if where on the chart do they fit. Obviously, the lower, you know, towards the 100, the closer you get towards 100, the more credits they're going to get. Remember, everybody qualifies. We're talking about credits, right? That they're going to get from the United States federal government. Guys, I love this business. It's backed by billion-dollar companies, which is our carriers, that is backed by the United States federal government. I mean, it does not get any better as far as a business, especially if you've ever done any network marketing before, if you've ever been in any company that's furloughed you or laid you off or seasonal or whatever, right? You got a real strong business opportunity here that is a long-term play, right? That is going to pay you residually every single month. And as long as there's a federal poverty line, we're going to be getting credits for that, right? So the first thing that I check when I'm meeting with a family is that where do you fall on the federal poverty line? I just need to know, just to kind of like gauge whether I know you're going to get some credits or not, right? You meet with a family before and they're at $35,000. By the way, very rarely are you ever going to put an exact round number. Pro tip number 2, right? And this one I could put on the record. Pro tip number 2, if the family makes $35,072 a year, put the $30,072, okay? If you put the $30,000, a lot of times that'll come back for verification, right? The system doesn't like round numbers, all right? So avoid the headache. It's not hard. You ask them for a pay stub, you upload it right on Sherpa. I'll show you where to do that now. Not hard to do, but just to avoid the headache. Again, if you're writing 10 or 20 deals a day, this is fast, guys. This is fast. You want to get to $27,000, $30,000, $50,000 a month, right? You don't want to be spending a lot of time doing admin work, right? And that's an easy way to avoid having to do some admin work. Okay, so FPL is the first thing that we're gonna discuss, right? And the SEPs of the 100 to 150. Hopefully everybody is clear on that. Those of you guys who are live, I'm going to pause the recording a second and give you a chance to ask questions on that. So yeah, so Doc made a very important distinction. If it's less than 100%, it is going to be referred to Medicaid, and you are not going to get paid. All right. So I just want to make sure that we're clear on that. All right. So once you have that, then you're going to go to your health Sherpa. Okay, and you're going to sign in. Once you sign in, it's usually locked in your computer, right? Every once in a while, you got to do an integration of your FFM. Actually, it's like every 30 days now. So I'm going to go through that real quick just to show you guys what that looks like. You just go in there, you click that. Your username and password should be saved. They're going to send you a code. You're going to put in the code. And this is good training because a lot of times people call me, hey, I'm getting this message, I'm not sure what to do there. This is exactly what you're going to do there, right? Once I send you the code, put in the code here, 039. You click on do not challenge me for the next 30 minutes, verify. 458039. Send again. Perfect training, guys. This is great training. I love it. If it ain't raining, we ain't training. All right, 032496. Verify. I'm not sure why it's asking me to change my password. All right, so, all right, Murphy, I don't got time for you today. So anyways, guys, as you see, sometimes it plays with you, and other times it does, all right? So anyways, Your book of business will be down towards the bottom. I'm not going to show that right now. Just going to go show you how to. Oh man, guys, give me a second. Let me stop the recording. Let me fix this a second. Sorry about that. Murphy was playing around today. So, by the way, Blue Cross Blue Shield is offering me this $50 policy. Do not use the referral through Health Sherpa. We have a bonus override pool, people that are licensed within our organization throughout the whole country, where you'll still get the full PMPM. Okay, so do not use the referral program through Health Sherpa. Did I say that clear enough? Do not use referral program through Health Sherpa. If we have a client that needs a policy in a carrier that you do not contract with, let me know. I'll send you the NPN override, and we could do it through an NPN override so you get the full PMPM. Are we clear? We good? All right, here we go. So how do you quote on Sherpa? So you go up here on quote on exchange. Oh, there we go. Quote on exchange. And then you're going to start from just like a newspaper, guys, left to right, top to bottom. So the zip code 33897, as an example, how many people in the household? It's going to be how many people in the household, total number, even if everybody's not going to get insured. For example, in the Hispanic community, very typical for my family to have the kids, the grandkids, parents, and grandma, right, in the household, right? You're going to count everybody, 5, 6, 7, 8, whatever the numbers is, right? Then on the left-hand side, you're going to go to county. This one is an example. Like there might be 2 counties per the zip code. You're going to put in the household income, and again, make sure you verify the household income with the FPL chart. Oops. Right. So a family of 6 here, they can make up to 55,000, right? 55,264 as an example. And then you start putting in everybody who is actually going to get insured here, right? So here it could be 45 male, right? Add spouse. If they're a tobacco user or a parent of children under 19, right? Here. If they're eligible for the coverage, you might not want to click there because if you do, they usually are not eligible, right? If you get lost, just highlight this, and then it usually tells you what we got going on, right? This one here, 45, let's say 40, female, right? Then you start adding the dependents, right? 17-year-old male, whatever, right? All the way down the line. And as you add them down the line, you're going to start seeing that the savings gets higher and higher. Okay. Do you see that? And then in some states, it might say this child may be eligible for SIPs or Medicaid. If they are eligible, you want to keep them on Medicaid. Do not check this. But let's say they're, again, coronavirus as an example. I have a client today that I have to write out of Texas, right? I wrote her by herself. She had 2 kids in Texas, and both kids were on Medicaid when I wrote her back in December. Now they're falling off of Medicaid. So here you would click this, and then it will add more credits because it will be more people that are actually eligible. You follow me? So once you add all of the dependents, right? So we got a 15-year-old male, a 10-year-old male, a 7-year-old female, right? Now you're going to see that there's a 1,390. Remember, the first one was like 400 and change. You follow me? So now we go down here, and you're going to see all the plans that are available. What I like to do to get the most credits, the first step is fill out the information up here, right? That's the first step. And then we're going to click on, just for the purposes of this exercise, we're going to say that they're all not eligible for Medicaid, so we can put the whole family on, right? So here we're putting all 6 of them on, and your total savings is 2,023. So that's step number one, is put all the information up here, right? Step number two, I use preferred carriers, right? And I'm going to share with you guys why. There's some carriers, like for example, Ambetter. They have a phenomenal back office for the client. They give the client money for doing things like going to the doctor, picking up prescriptions, and stuff like that. So when possible, and by the way, they also pay better. There's a $30 in Florida, PM. I'll click on Ambetter and let's say United as an example, right? Florida Blue, do not click Florida Blue unless if it's absolutely necessary for that client, for that area. But Florida Blue, or actually any blue, is a captive through the state. So we do have NPN override. We can write it. We're not going to get paid a lot. And again, unless the customer really wants it, don't even talk about it. More importantly, here on the metal levels, I'm going to start with silver. Now, if silver we can't find them a good plan, then we're going to go back and go to expanded bronze. But we're going to start with silver. So step one, information up here. Step two, pick the carriers that you like working with. Step three, metal plans. And then step four, if you start seeing a lot of zeros here, I like to go up here where it says deductible, and I like to put the deductible at 0 or as close to 0 as possible. Okay. And here we go. Everyday silver plan, EPO. Remember, HMO is when you need a referral, PPO is no referral from your primary doctor, and EPO is a hybrid, right? And then I like to read it like this. I said, Mr. Client, we have a policy here that is a silver policy. It is $0 a month, right? After your credits, $0 deductible, $1,400 maximum out of pocket. Your primary will be 0, no charge. Your specialist will be 10, and your generic drugs will be 0. Looks good. Let's see if we could find something better. Look at this one. Has all the same. Now the maximum out of pocket is $1,200, and your specialist is 5. That looks good. I'm going to click compare. Right. We're going to keep going down. Maximum out of pocket on this one. This is an enhanced $925. No charge for doctor specialist. Boom, 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 boom. Right. Now let's say they have questions about the plan. Here you can go through all the doctors, all the drugs. Right. Let's say metformin. Does this plan take metformin? Right. You're going to go to 2023 formulary, and you'll look up metformin as an example, right? Look up all the drugs if they're on. Usually in ACA, unlike last week's call in Medicare, you're going to have a lot of drugs, right? Here, usually there's not taking a lot of drugs. If anything, it'll be like for some blood pressure medications, minor dosages, or diabetes, minor dosages, right? It's not like this list like in Medicare, right? That's another conversation. That's why we have these meetings on 2 separate times. But anyway, how to read formularies. You go in here, tiers, tier 0, no co-payments. Usually these are your regular drugs, you know, over-the-counter stuff, aspirin, smoking stuff, right? Tier 1, lowest co-payment. Tier 2, medium co-payment. Tier 3, high co-payment. And then tier 4, the highest co-payment. This is going to be like your very specialty drug for like cancer or AIDS or something like that, right? But again, everybody is accepted, right? And then it'll tell you some abbreviations, right? So like it might be like an age limit, quantity. The most important variation that you're going to see here is when they do a step up, right? What's called step therapy. They might, like, let's say somebody wants Ozempic. That's a big thing right now in diabetes. They might want Ozempic. Well, they'll start you first on one drug, and then they'll scale it up to that, right? This is an example. So what I do is I use a PC. I don't know Apple. Those of you guys with Apple, just do your control feature, right? Your find feature. So Control F will pull up the control find, and then you put metformin. That's an example. And then you see metformin is a 1B, right? So it's a tier 1 drug, which means that's going to be covered for the majority of the cases, right? Jardiance, as an example, let me see. It's a little bit more expensive drug. Jardiance is a tier 2 for Ambetter, right? So there's going to be a copay about 20, 25 bucks or whatever. You follow? So that's kind of how you look for the drugs in case that they require that, right? But anyways, I like to pick out like 2 or 3 different programs. So I'll go like this one here, Ambetter. And by the way, we sell a lot of Ambetter because the price is unbeatable, right? Let's say they wanted to see adult vision and dental and stuff like that. And then once you have that, down at the bottom, you see all of them come up that you've clicked, compare the three, and you go here and you can compare them line item by line item, boom, 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 right? This one looks pretty good. $5 specialist, primary care 0, boom, 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 boom. Add to cart, start application. First name, last name, date of birth, receive complete, and then you do the application. The application will take you about 5 minutes. Once you're done with the application, it's a wrap. Next, right? If it needs verification of anything in your Sherpa, we'll do a training on that specifically on another call. If it needs verification of any income or stuff like that, sometimes immigration status, right there on Sherpa, it'll have a click where you click and you upload the documents for immigration status or for income or whatever it may be. The immigration status is a huge change that we just recently discovered, very big for us in our Texas team, is the fact that they do not need to have residency or U.S. citizenship to be eligible for Obamacare. A lot of the forms, as long as they have some kind of immigration status, right? They have something with an A number, A dash whatever. There's a lot of different forms, right? They will qualify for Obamacare. Okay, that is our Obamacare training. For those of you guys who are live, I will go ahead and stick with you. If you are watching this recording and you need help at any time, feel free to reach out to me, Armando Torres. Armando Torres, my phone number is 305-409-6835, 305-409-6835, and we'll definitely help you get started. We'll help you get contracted. We'll help you with your cases, and we'll help you build a big, profitable book of business. See you guys later. For those of you guys who are live, I have a few minutes. I can answer some questions.